Hello everybody, and welcome to Coproduce Care chat. We are really looking forward to this chat for care. I've got a fantastic guest who's going to join us in a moment. But before I bring them in, I just want to remind you that please do share and like and make sure that you bring as many people into this live stream as you possibly can. We'll bring up some banners in a moment just to remind you of how to subscribe. If you're on YouTube, make sure that you do that. And also, if you are listening to us on Facebook, then please like what we are doing and just share the channel and get more people talking about care. So today, I'm really delighted to have with us Karolina Gerlich, and she is from the Care Workers charity. Karolina is the executive director at the CWC, Care Workers charity. And I've got to say, she has to be one of the most inspirational people I have ever known in this sphere of social care. She has been working tirelessly to try and make sure that social care workers in any form across the board get better representation, that the issues that they're facing practically, politically, are really looked at and really represented, whether she is writing an article in The Guardian or whether she's trying to raise money for people or talking on the news, trying to highlight some of the real issues that people are facing. A fantastic spokesperson for the sector and especially for care workers' rights. So Karolina will be talking to us about a whole host of issues. And it's the great thing about having these live streams is that you can get involved in the debate. So please do comment as much as you can There's a chat area, comment box, wherever you're watching us, whether it's in YouTube or whether it's on Twitter or Facebook, just write any comments that come to mind and make us feel like you're kind of in the room with us and having a chat and we're all agreeing or disagreeing or creating new ideas about what we're talking about. So please do get involved. And as I say, the whole point about liking and subscribing isn't so much because we want to feel good. That is nice, but the algorithms, it just brings more people to the channel. It brings more people to the idea of talking about social care, learning about the different issues. So it's really fantastic when you can just do a couple of clicks. It means a lot to us. So do click away as we get into our discussion and subscribe on YouTube if you can as well. So before I do get to Karolina, I do want to update you on a couple of things that we're doing. So next week, we will be interviewing Kate Taroney. So Kate Taroney, if you don't know her, is a Chief Inspector of Adult Social Care for the CQC, the Care Quality Commission, which is the regulator. Now, in true co-production style, we wanted to get your questions to her. So what we did this week, and if you follow us on our social media, you'll see that we went out to you and we asked you if you've got any questions for Kate on the hashtag questions for Kate. And we wanted to prep her with some of your questions and get those to her nice and early. So we've got a whole host of questions. We'll be talking probably about some of the things we're talking about today around registration, recognition for care workers, and some of the things in the news. I'm really interested in seeing her perception of social care after the many sort of online remote telephone conversations she's been having or her team has been having with social care providers. And holding that up against some of the comments that we had from our Prime Minister about care homes and care providers a couple of weeks ago. So I really do recommend that you tune in to have those discussions with our regulator. And if you still have some questions that you think we should be putting to Kate Taroney, then just tweet us or get in touch. It's absolutely fine. We can still ask her some of those questions, especially if you tune in on the night next week, Wednesday, 7 o'clock, then you'll be able to ask questions yourself. So even more incentive to watch us live. So before I get too busy with just babbling on, as I always do with these things, I'm going to bring Karolina into the live stream.
Hiya.
Hello, Karolina. How are you?
I'm fine, thank you. How are you?
I'm so much more better for seeing you. How corny. But no, it is really, really great to have you on the live stream. I know it's been difficult to get some diaries in the dates in the diary rather for both of us. So it's really good that we can finally sort of sit down face to face ish and have a discussion about social care and social care workers. So to start off, obviously, I've been following you and I know a lot of the work that you've been doing, but it's always good to give people a bit of context around what you do at the moment in the Care Workers charity and why you think supporting care workers in this way is so important.
So yeah, I've been with the Coproduce charity now for around 4 months, and obviously started just around when the lockdown started as well. So straight off, we decided to run a COVID-19 fundraiser to support care workers, either self-isolating, shielding, or sick with COVID, to make sure that they have the financial support that they need. So in the last 4 months, we've managed to raise £2 million, and we are delivering grants to care workers all over the country, from £500 to £2,000, making sure that they don't have to worry about paying for food or petrol.
Wonderful. And it's really impressive how much money that you've managed to raise in such a short period of time. When did you start fundraising?
So we started fundraising on the 1st of April. So
Wow.
3.5 months. The team has been working very, very hard around the clock. And I have to say they really care about care workers. They take all of the applications to heart, and they all work very, very hard. We all do, to make sure that we can get as much money as possible to as many care workers as possible.
And some of the things that you've been doing, I've seen in, I think I saw a tweet about one of the supermarkets. You had a pizza that was, people, all the funds of that particular pizza which was in sort of like a mosaic of the rainbow. That was being sold in one of the supermarkets, and all the proceeds were going towards supporting the Care Workers Charity Fund. And also we picked up the Going the Extra Mile challenge. I don't know if you know much about this, but it's the Kado points as well, which is another way that people can help, a creative way of supporting with donations. So yeah.
So as some products and proceeds are being shared between us and NHS charities. So there's a T-shirt and a pizza, like you said, rainbow pizza, and then towards Christmas there's also going to be a bath fizzer, just a nice gift for people for Christmas stockings. So it's been great to have that presence in shop, because that gets social care and care workers awareness out to the public. Had Just Eat raise money for us for a Superhero Sundays initiative, again focusing on care workers as key workers during the crisis, and a lot of other things that from different organizations that felt supporting care workers is very important during this time. In terms of going the extra mile, yes, it started on the 20th of July. We would love more people to sign up. You can sign up as a team in your organization or as an individual, and then any physical activity or mental health activity that you do, it could be yoga, it could be breathing, walking, cycling, etc. You can track that, and that gets your team points, and that you can use that also as a fundraising tool to try and bring some money to us as a charity, so then we can deliver that to care workers.
Yeah, that's wonderful. And also, I was looking at some of the things that care workers can do with the grants. You have kind of pots of money where they can access it and use it for different things. You've mentioned a little bit before, but there's some grants towards daily living costs, up to 500. There's some home repairs where people can get a grant of, again, up to 500. So you've really thought about ways in which people might need to use that fund, and then helping them in those kind of practical ways. Was that something that you as a team came together and thought of ideas, or did you go out and ask people how best they'd like to use the fund money?
So those particular things are part of the ongoing grant stream that is crisis grants, and that from that funding stream we can get people money for broken white goods, repairs, like you said, car repairs, loss of income, etc. But that's been going on for years now. We keep reevaluating what should be included in that, what are people's needs, from the reports that either the surveys that either the charity or other researchers run. One of the things that came up with COVID-19 was car repairs, because care workers were struggling to be able to actually work when their car was broken, as those can be quite expensive.
Yeah. And in terms of why you think it's necessary to have this fund, and you probably should make a point actually for any care worker who might be watching who thinks, well, is it something I need to pay back? But it is non-repayable, isn't it?
Yes, so you definitely don't have to pay it back. There are some rules around how often you can apply. So it is once a year or once for COVID. Yes, it's very difficult, because in the ideal world, we as a charity shouldn't have to exist. Every care worker should be paid enough so they wouldn't be in financial crisis ever if they're applying their finances well. But obviously we all know the situation with care workers' pay. So we are very much a necessary charity, especially in COVID. Our existence has been, there's a light there shining very brightly on us right now at this moment. More and more care workers are applying. We've had over 3,000 applications in 4 months.
Wow, that's incredible. Do you think that's because of awareness of the charity, or just people know it and they just actually feel at this time they really need the extra support?
So we've definitely been working on raising the awareness of the charity and reaching out to more people that we're there, using social media more for advertising as well. But I think with COVID, that need has become rather urgent when people had to self-isolate for 2 weeks, were losing their income for that period of time, and really felt under pressure.
Oh, yeah, this is the thing. We're not properly thinking about social care workers and the support that we need to give them, really preparing them for it. So in terms of you getting to know your journey and how you came here, so you're very much involved in the care worker journey and what's involved in care work. You often find people who work in as executives or directors of some of these organizations. They've never actually done any care work before, which is fine, but your story isn't like that.
No, so I've been working in social care for almost 13 years now. It'll be 13 years next month. Ever since I came over here from Poland, and that's in different roles, supporting people in their own homes, in home care, in live-in care for almost 5 years as well, bits and pieces here and there in care homes, but mainly working with people in their own homes. And Friday morning, I still go and do one visit in London, just to make sure I'm still with it. It may be back to 2 soon, when the other lady comes back from Scotland, where she was shipped off by her family because of COVID. But yes, I still really enjoy the job, and I always have. And I find it very important to make sure that I still do it in some sort of way.
Yeah, and it's good because it keeps you grounded. I think sometimes even within people in commissioning jobs, if they've worked in care and they haven't worked in it for like 10 years or 15 years, you almost sometimes forget the day-to-day joys and also the challenges of being a care worker. And it is amazing that you fit the time in to do all these different jobs. But in terms of all the stuff that you do, all the campaigning that you've done, what would you say you felt has made the most impact?
So the most attention that's been given to were my comments around immigration policy. Obviously, myself being from Poland, it puts it into an interesting perspective, because if I were to come here next year to be a care worker, I couldn't really, if the policy as it stands goes ahead. So I think that brings a lot of attention to the sector, and I hope that at some point there will be a U-turn on classifying care workers as low skilled, because I find that most of all unacceptable. It's very disrespectful of the workforce, and you know as well as I do, and hopefully all people listening right now, that care workers are really incredibly highly skilled, and they have to apply a variety of skills and experience into their job every day, and it really matters who you are as a person to be a care worker. It can't just be anybody. So I really feel that the immigration policy unfortunately sets a very bad precedent for other legislation potentially classifying care workers that way, which will then make it very difficult to support them.
Absolutely. And I've just seen it. I've just popped up a screenshot of your article that you did for The Guardian quite swiftly, actually, after those announcements were made for the immigration bill. So again, it's just highlighting at every point when there are decisions being made, how they affect social care, because I think sometimes it appears as if social care isn't even considered when these when legislation bills are put through and policy. It's almost, well, if it does affect social care, I'm sure they'll be fine. But I want to come on to something that was on Twitter quite a lot earlier this week. And I'm going to introduce it through a short clip from Sky News, and then see the response on a challenge from this from Kit Malthouse, who's a Conservative MP.
900,000 public sector workers are in line for a pay rise. Let's take a closer look at the numbers behind the announcement, should we? Biggest pay increase is going to be 3.1%, and that is for teachers. That's followed by doctors and dentists. They will be receiving 2.8%, according to the Chancellor. Police, prison officers and staff at the National Crime Agency, they will see a rise of 2.5%. And judges, top civil servants and military top brass, they will be getting an extra 2% in their pay packets, if that's what judges get. Now, Chancellor Rishi Sunak says the past few months have underlined the vital contribution public sector workers make to the country.
So that is pay for public sector workers. And obviously care workers don't come under that because they're not under the public sector. But this was challenged or discussed then, I think, the next day, maybe on the same day, definitely earlier this week, on BBC 4, Radio 4. We'll just listen to this, and then maybe you can come in with your thoughts on the response from the MP, Kit Malthouse.
Social care is not on this list. Social care paid for mainly through local authorities. The local authorities say we do not have the money to improve their pay. That is wrong, isn't it?
Well, the vast majority of social care workers obviously paid in the private sector, and so our ability to influence pay rates there is limited. However, it could be very easily done, couldn't it, by simply saying, look, this is the minimum that someone in social care should get, and the local authority will make up the difference between what is earned in the private sector and what should be earned. Well, what we have done is obviously raise the level of the minimum wage up very significantly over the last few years to get it up towards the £10.50 mark. And that, we hope, will push through into these private sector jobs. I mean, look, everybody, you're quite right, Justin, looks at people who were working in social care during coronavirus and thinks they've done a fantastic job in very, very difficult circumstances. But that's the mechanism by which we think we can increase pay in that sector.
So there you go. MP, Conservative MP Kit is saying that the mechanism by which we expect to increase the pay of care workers is the national minimum wage. In response to, obviously, the public sector rises in pay earlier this week, the announcement from Rishi Sunak, the Chancellor. What's your reaction to Kit's words there?
Unacceptable and disrespectful, really, I think, his attitude. And other people who think that way. The contribution that care workers make to the society, to the economy, should never be measured by national minimum wage. The clue is in the name. It is the minimum wage. Care workers do not make minimum contribution to the economy or to the society. Quite the opposite. Always going the extra mile, always doing as much as they can, personal sacrifices around their family, health, and lives in the COVID-19 crisis. So it should never be a discussion around, oh, we're raising national minimum wage. The other problem around that is also, and I've been seeing a lot of it since the last increase in national minimum wage, is that it pushes the margins, the difference between somebody who's just entering the sector, people who have been in the sector for longer, senior care workers, etc. In some cases, I've been seeing from care workers saying they're getting 5p an hour more, having worked in the sector for 10 years, than somebody who's just come in. And again, we cannot do that. We need to be able to show that in social care, there are career opportunities, development opportunities, but that goes along with, pay increases, or the time that you serve, the training, additional training that you do, and qualifications, and that needs to be recognized. And I do not believe that an excuse that, it's mostly private sector is ever valid. There is a reason why we're mostly private sectors, because of ongoing, for decades now, neglect of social care by different governments. So there was no choice but to go private, and for private companies to pick up the slack, really, and look after people who need it.
But also there's an answer that the host there for Radio 4, BBC Radio 4, was saying that you could streamline extra funds to local authorities who could then put a ring fence on that money for the pay of care workers. So it's almost like they use that as a get out of jail free card to say, oh, well, it's the private sector. And then even worse now to say, well, it's the national minimum wage. That's the way by which we're going to be using any pay rises. And that, I think, is a bit of an insult, really, to care workers in the same conversation as pay rises. And it's not even that care workers are on a par with health workers. The rates of pay, the benefits, the sick leave, the full pay sick leave that people can, in nurses, NHS can get, it's just a world apart. So it's very different from that world. And I just think that from what you were saying earlier, there seems to be a rhetoric around social care that's really quite negative, whether it's looking through the paradigm of immigration or pay. And the next thing I want to come across or talk about is the recognition in terms of registration. So why do you think there is this this negative rhetoric around social care? Is there anything to do with the fact that it's not politically popular? I spoke to someone on our last live stream, Alistair McClellan, editor of Health magazine, and he was saying that it's a bit like a political hot potato social care. But I wonder if it goes a little bit deeper than that. Is it the fact that there's a lot of women working in it? I don't know. What are your views?
So I think there's definitely an issue of social care being a very gendered sector. Some of the duties that care workers perform have traditionally been seen as unpaid duties of women, wives, daughters, etc. And I think it's gone very much unnoticed how much more complicated they have become over the years, how many more clinical duties care workers have had to take on, and how much more complicated people's health conditions become, especially when you have comorbidity at later life. So yes, that there are issues of gender, and I think the main problem is just the general public misunderstanding, lack of understanding of what social care is. And I suppose there's a good thing with exposure of social care around COVID, is that hopefully more people now understand what care workers do and how they contribute and how important they are. They are care workers, they are at the front line, and they are extremely important. And we really need to try and all work together on getting more positive stories out there and trying to balance out the negativity out there and disrespect, and promoting all the positive stories. And you've got a lot from your company, and we've got from many others in the sector, where care workers, care managers, care business owners, everybody have been working 24 hours a day, 7 days a week in the past few months to make sure that they can actually deliver the best care in this terrible situation, where people have been leaving their families for 3 or 4 months to make sure they don't spread the virus either way. And just going to live in a care home for weeks on end to, again, make sure they can support people the best way they can. Social care is a safe place for people to be, and we need to keep reminding people about that. We've had issues, obviously, with the number of deaths, which is heartbreaking, but that cannot really be blamed on social care providers. There were other national level factors at play around testing and PPE, etc. What we go through, get through as a charity when people are applying to us is, I'm doing my best, I love my job, I love helping people, but I just don't have enough money, and I need your help. And what we are getting a lot through the fundraiser was people donating money, including actually nurses, which were saying this is unacceptable, the way care workers are paid and not having full pay when they're having to self-isolate. And messages from families saying, I would like to donate this money because my mother is being looked after so well in a care home where she is. Or I would like to donate this money because I've had a personal assistant coming and support me for years now, and without them, my life would be so much worse. So there are so many people out there so happy that they have the support. And we just really need to try and change the dialogue that's happening between the public and the media, I think, about it, and the focus of it. And obviously, a recent comment made by our Prime Minister trying to shift the blame onto the care homes around deaths is extremely unhelpful. Most of all, it isn't factual. And I think we just need to try and put a lot of effort into changing that opinion and an impression that the public may have gotten from that.
Yeah, absolutely. I think that's a very good point. It's a lot of work to wind back on a comment that was made at a time when we should be creating unity and togetherness. It was very unfortunate, really, that got recorded and that got so much airtime. But it still is helpful to know how people think. So, talking about registration, because I know that you have sort of concentrated on this before. What are your thoughts on registering care workers?
So, first of all, care workers are definitely professionals. And I think if you have a workforce that is full of professionals, that should then be registered, because it offers protection and rights both ways. It offers protection and rights for care workers to be supported, to have access to training, to really become a part of a recognized workforce. But it also serves as a protection to the public, where we can make sure that only the right people are doing the jobs, that only people with the right skills and training are supporting people who need them. So yes, I think it's very important that we recognize care workers as professionals.
So I just brought up this article, and I've got to admit, I think might be the article where you and also Clinton Farquharson from who also works at TLAP had a discussion about the pros and cons of registering. Is that right?
Yeah.
So what do you understand about the people who are a bit cautious around the idea of registering social care staff?
I think where we really need to put a lot of consideration into it is where you draw the line, because what you don't want to do is put the community off supporting people in need. So we need to be very clear when someone becomes a care worker, where is the level of support that requires training? How many people do you support on? What are the things that you support them in? And obviously there is, I think Clinton worries that could possibly limit choice.
Right.
But what I always try and say to that is, it isn't about limiting choice, it's about making the choice safe, because that would put some safeguards in place straight away that certain people wouldn't be able to access roles. So there's still plentiful choice of people who can register. It's just going to be much safer, and in a way for people like Clinton, for people who employ personal assistants, for example, it should make it easier to know who may be the right person for them. And yes, working in care, especially when you, let's say, a working age adult with a disability, is very important how your personalities merge. If if that works, because the relationship is so close and is constantly one-on-one. And there is a lot to do, and there are a lot of activities outside of the home as well to be considered. You know, you're supporting somebody's well-being in every role in social care, but each different role has different challenges. But like I said, it's not about limiting choice, it's about making it safe for everybody involved.
Yeah, I think it's an interesting argument to have. And I think if we were to go down the route of registration, it would be nice to have as many organisations and people contributing to the debate and what it looks like and how it might be administered, because I know that some of the arguments are that, well, it's an extra burden for care providers, for example, but if it's just in an aim, really, because lots of the work that care providers are doing already is around training around the common induction standards or the care certificate now. So maybe what we're doing already is that, like you say, it's skills, it's just making sure that people are recognised by it. And I wonder, you know, when we think about comparisons, I think Scotland already registers its care workers, as does Wales. So there is an opportunity to learn from how it's going there. It's not like it's a brand new concept that's totally alien, is a bit out there. They're already doing it, you know, across the bridge and across the borders. So we might as well get involved in doing that if there's going to be so many benefits for it. And I think from the chats, the Facebook groups, care workers, I think, would appreciate that title of being registered as nurses or OTs or other professionals in a similar health role are registered. So it would be a good debate. In terms of the things that we've mentioned in your other activities, and I know that you write and I know that you are involved in the Care Workers charity, how do you feel we can get better support for care workers in this political sphere? So you have a lot of individual bodies who are supporting care workers, but how do we get their voices heard a bit more? Would that be through unions or through better representation in different places? What's your idea about trying to get care workers' own voices heard on this platform?
I think, first of all, we need to work on giving care workers confidence to speak out, whether it's writing a letter to the MP or posting certain opinions on social media and getting support of their friends and family, because sometimes that's where problems are for many care workers, their own families, their own friends. And this is a case, you know, in my own life. It's been quite a few times where my own friends didn't understand or respect the work that I was doing, or the family telling me, can you not do a proper job?
Yeah.
You're too smart for this. And it's like, is it really? So there's that huge misconception. So I think giving care workers a lot of pep talk and confidence, so they can actually just on a very small level at the moment with their own environments have the confidence to actually stand up for themselves and say, actually, I am a professional, I do a lot of important and skilled work, and then building from that. But we are really struggling with care workers feeling like they are entitled to more, I suppose, because the sector and the workforce has been beaten down for so long, being told we're unskilled, all we do is bum wiping, and we are insignificant compared to our health colleagues. And I suppose another thing is having the health side of things respect us more and show us that respect, because that's sometimes where issues come from as well, when we are not being recognized by other professionals.
Absolutely. And it's funny when you talk about having the government seeing social care as a whole as valued. When we, again, last week, when I had a live stream and I brought up some clips from the NHS's chief executive, Simon Stevens, and from an interview he had with Andrew Marr. And he revealed that basically Matt Hancock had given the NHS a blank check with regards to COVID-19. He'd said that really whatever you need, you let us know and we'll make sure that you get it. So, and you look at things like the Nightingale Hospital, that things just happen when it's to do with health. But when it's to do with social care, it's almost a quite a disregard, and putting, as we've seen with the figures with care homes, in danger. Are you worried for care workers as we move out of summer into autumn, potentially into a second wave? Are you worried that fatigue, and the fact that we might not have quite got through what social care needs to the people who make the decisions, are we worried about what might happen for social care workers going forward?
I think there's definitely a huge concern there. Last 4 months have been very stressful, very draining for the workforce. Very unfortunately, I've seen quite a lot of people leave, and it's very difficult to convince them otherwise at the moment. And in the sector, we do need more people to come in and do this job that gives you such a great feeling of fulfillment and happiness. But it's a very difficult argument to make, especially at the moment. I think our concern now is moving more towards mental health and long-term consequences of facing and having to deal with so much bereavement. So many care workers have lost either their colleagues, family members, or people they're working with, and in many cases it would be more than one person. So we are currently working on launching a mental health support grant stream, where we will hopefully be able to support care workers with therapy. Not we ourselves as a charity, but partner with an organization that would be able to do that, because obviously at the moment private therapy is definitely outside of most care workers' budgets. But if you consider the issues, potential PTSD, anxiety, all the additional stress, that's probably what's needed. And with NHS mental health provision already under a huge strain and waiting times around 6 months, we want to try our best to be able to deliver that to care workers much sooner.
That's really thoughtful, because I think there's a lot of talk about the post-traumatic stress that people may face going forward. And it's just that combined and constant issue of dealing with having to go to work, having to think of what's happened with COVID. I feel right now it's a little bit eased off, but having in the back of your mind that there's lots of things that are changing, and all those kind of issues coming together can be really stressful time for care workers as well, with the additional issue of, well, they're going home to people who might be self-isolating at home, and obviously they might be in areas which are potentially high risk. So I think it's really great with what you're doing there at the moment. I'm going to go, there was a question here from Mark. I'll bring it up here. So do you give funding to carers whose second non-care income has stopped during COVID-19?
So all I can say is we do have 2 grant giving schemes. Every case is really considered. We do have an assessment process, but it is considered on case by case basis. So if we look at the loss of income in our crisis grants, potentially yes. I can't say for sure, obviously having not seen more details, but I would say is crisis grant stream would probably be the one to apply for in this case.
Absolutely. And that's really helpful to think that, people just need to go and apply and inquire and see what's available and then go from there. So like I said earlier, I'm going to be interviewing Kate Tirone from the CQC next week. Is there anything that you think I should make sure that I put to her, or any question that maybe you would like to know?
Well, I know that Kate cares deeply about the workforce, and, it's been a very difficult time for everybody, including CQC, trying to work out what they're doing. I suppose what I would ask, and what I have seen being a huge concern from care workers and care managers, is how CQC as a regulator are going to respond to the fact that still many things are very much open for interpretation in social care in regards to COVID, like even PPE. It's very practical things, like I saw managers having a discussion the other day about care workers' breaks in a care home, and have they reduced them or have they changed them to only 1 a day, because you do have limited PPE, and PPE is not cheap in the first place. If somebody's got a mask on for the shift and then they go on a break, they should really take that mask off. And then do you make them wear the same one? But then how reasonable is that? Do you ask them to wear a new one? But that gives you additional costs and having to make sure that the equipment is there in the first place. Do you do something like having boxes for individual care workers where they can put them away for the break and then put them on afterwards? But should they also wear a mask on the break that should be a different mask, considering that virus doesn't take a break? So there's like this huge consideration around what you would think is quite simple, care workers taking their breaks. But when you put the whole PPE and a virus that's absolutely potentially everywhere into the mix, it makes it much more complicated. So I suppose, yes, if you were to ask any questions from me, it would be, how is CQC considering all of this openness for interpretation thing, so not any more stress is put on care workers and care providers when already it has become an almost impossible situation.
I think that's such a good point around the PPE, because there's been new guidance, which I haven't read myself in full, but one of my team was telling me, who SWATs up on this, and they were saying it's all about taking off your mask in the breaks, and you should actually have a brand new one when you go back, so if you go for a fag break or whatever, and how that straight away doubles, triples, quadruples how many masks you need just by the implementation of that. And to what extent are we ready for that level of change? And the exact problem that you say, we're right back to the beginning then, where we know we should use masks. The guidance says we should use masks, but what if, not even the availability of masks, but it's the costs. The costs might price you out of having enough masks there, where you then are having to have the decision between what care you're able to give people and how many masks you're able to buy, because it's that tight. So I'm not quite sure whether organizations have properly costed this out yet, because I remember you got to a stupid stage where you had masks were like, I don't know, a few pence a mask, and then they shot up to £1 a mask overnight, and it doesn't seem like much, but when you change, each care worker has to change a mask like 10 or plus times if you're going from different place to place a day, and you've got 100 to 200 care workers working for you, the costs very, very quickly stack up. So again, that's a practical thing that you don't necessarily hear people talk about. So in the social care sphere, people don't often really sympathize with all the nuances of the difficulties of things like PPE. So yeah, absolutely. And then we've got another comment. Yeah, carry on.
And I suppose when you look at home care as well, then you have somebody who's potentially going and visiting a few different people in a day. Should they wear a different one for each person? And then the way I've done many times, you go and visit a person, support them. Part of that support is going to do shopping for them. So then do you wear a different mask for your travel there, a different mask in their house, then you go to the shop and you wear yet another mask and then come back, because it's very practical, and I think it's not really thought of until you actually have to do it. Sometimes, and like you say, the cost of it is enormous, environmental impact potentially enormous, and in home care, just getting it out to care workers themselves as well is yet another challenge. So I think we still have a lot of things around PPE that haven't been answered, and then when we get grant applicants to the charity, they apply and say, I've had to shield for 12 weeks. Shielding is now going to be paused. I don't feel safe and secure going back to work because there are still issues and things like that keep coming up. I don't know if I'm going to be safe. And then, it makes us think about it, what is actually being done. Or is there enough being done to give care workers the sense of security? And it seems like there isn't on a policy level, because then we're having people coming to a charity that's actually giving financial grants, talking to us about things like that. and saying, now I feel in a position where I actually have to stay at home. So I would need financial support because this is my choice. I won't be eligible for any other support. So yeah, it makes it very difficult.
Yeah, and it's a good point about shielding, because some of so care homes have got this infection protection control grant, and you can use it to pay full pay for any care member of staff who is shielding, but that has to be used by the end of next month. And of course, the shielding rules have changed. So even if the virus hasn't changed, the shielding rules have changed, and you've got that extra anxiety of people knowing that, well, I don't technically have to go back to have to shield, and I could go back to work, but also I'm really nervous about going to work, considering as well the environment that I'm going into. But despite all of that, care workers generally are so upbeat about what they do, and they don't necessarily like to go out marching and protesting about what's going on. They just want to do a really good job. So things that you're doing with the care workers charity, I think, are so important to go and speak up for those issues that are being faced by care workers. So in terms of some of the other things that you're doing, we found this, and the Sustainable Care Advisory Board. Can you explain to us, is that anything much that's going on there? It's been going on for a year. Do you think anything's going to come out of that? You've got some big names involved. Professor Martin Green from Care England, Richard Humphreys from the King's Fund, and many others. What's this advisory board doing, and who does it advise?
So this is research between University of Sheffield, Kent and Birmingham, looking at care systems and making social care more sustainable in the UK. So they've been doing this research, I'd say probably for almost 2 years now. I think it's coming up to 2 years. And the program is going to finish August next year. So it's a 3-year program. Looking at international evidence of social care, where things are working, where things aren't working, and what lessons can we learn from there. Mm-hmm. Looking at potential new or different innovative models like well-being teams, Bertzug, micro providers, for example, and just trying to really talk to a lot of care workers, care providers, and representatives of the sector. What are the issues? And trying to collect data that maybe wasn't there in the first place, because we know there are huge data gaps compared to health on the workforce that we really need to fill to be able to support care workers better. So yeah, there are a lot of brilliant academics involved with that, and obviously a lot of amazing people on the advisory board, and it's there to support the sector. It's there to make sure that there is evidence research in place to support our arguments. A lot of it wouldn't necessarily be rocket science to you and me. There are some interesting findings, but it's more about making sure that it's formed as research as well. And it's people who are not necessarily within the sector having a look from the outside and putting a different perspective on some things as well. Because I think, like anybody else, people in social care may at times get just a bit of a narrow focus, and it always helps to have somebody from the outside point a few things to us to make sure that we can improve things, because you can always improve. So yes, it's a very great project, and some research has already been published by them. So I do encourage everybody to have a look on the website, and there will be more coming. But yeah, an amazing team of researchers across different universities with so much experience. It's humbling even talking to them.
That sounds amazing. And also the fact that we're building up from all angles. You've got the research side, trying to get care workers involved a bit more with even lobbying for what they need, better recognition in the press. I know you've had loads of interviews everywhere. You've even been on a Zoom call with, was it Will and Kate? So you've had the royal family involved as well. So there's a lot going on, and you've kind of attacking it from every which way to try and get things change for care workers. Do you feel now that people are listening and honestly want to make change in government, or is there still quite a long way to go to change perceptions?
I think COVID has definitely helped with the public's perception and has moved social care higher up on maybe people's list of priorities for consideration of importance within the society, as it happened, with other key workers as well. What pandemic has very clearly shown us is which people we really cannot do without, and which people, well, possibly can work from home or could be furloughed, and things still keep moving. So that's been very important. All of the positive stories that we have seen about sacrifices and hard work of care workers in the media have been very welcomed. At the national government level, I think there is definitely pressure for things to be changed, for reform, and for quite a dramatic reform. Sticking plasters and small amounts of money is not really going to work anymore. So hopefully very soon we'll see some of that coming into fruition.
Yeah, absolutely. Very much, hopefully. And obviously we'll try and do the best that we can. And in terms of the future for the Care Workers charity, what are you working on in the future? I mean, what you're doing now is amazing. Just doing more of the same would be great. But are there any other future plans?
So in terms of our strategy going forward is making sure that we keep getting feedback from care workers, so we know what are other areas to support them. So like I mentioned, we're looking at hopefully launching mental health support later this year. Next year, maybe looking around physical support, and then depending on what else we get as feedback from care workers, looking at other areas. We know, for example, from our applicants to date that there are care workers living in homeless shelters. There is a proportion of care workers who are victims of domestic abuse. So those are areas that we may potentially have a look at in the future, probably mainly around partnering with other organizations and charities that are already very well established in that space, so we can improve our signposting and information service to care workers and support them better in where they could go.
And what about you? Any more articles or anything else that you're supporting?
Oh, yeah, well, definitely. So we're doing Professional Care Workers Week in September. We had it last year and the year before.
We lost you for about 10 seconds there.
Oh, right. So the first week of September is going to be Professional Care Workers Week, from the 1st to the 4th of September. I organized it last year and the year before as well. This year we're looking at a week. Obviously we're going digital because of the current circumstances. So we are going to have a lot of webinars, trying to get people involved, launching the mental health grant stream, and just trying to both hear from care workers, from leaders in the industry, try to have a good and healthy debate around issues, but also recognize the contribution that care workers have already made. I think as a sector, we need a little bit of a pep talk and confidence boost and a good pat on the shoulder as well for all the amazing work that people have done. So yes, the first week of September, that would be the aim for that. So as a charity, we're going to do our best to get it not just within the sector, to reach out outside of the sector, hopefully get the public involved as well, to just a much larger scale clap for our carers situation.
Yeah.
Trying to show care workers that they are appreciated and they are recognized as skilled professionals.
Well, September can't come soon enough for me, because I really want to get involved with that. And I love the fact that it's a whole week. And I hope people thinking about it coming on to the end of July, you've got plenty of time to organise your own activities and get involved with whatever you're doing there, because usually classically on the day, people might celebrate care workers, they might give them gifts, some kind of recognition. I know that we in our care organisation, we collected some thank you notes for the people we support. and created a little booklet for care staff to take away with them. And actually, it was amazing to hear what people said about the care staff that they have, because for some people, it's more than just somebody that comes in a few times a week or every day, but it's like a member of family. And I remember one family member wrote a letter to us saying that we're like the fourth emergency service, because obviously whenever anything's wrong with their parent, their mum, they ring us to see if we're around, we can pop in and help. So more stories like that, I think, in September. It would be lovely if we could share. And I think that's a lovely point to end on, really, Karolina. It's been fantastic having you on, and definitely maybe have you on again, maybe closer to September for a quick 10-minute promo for Care Workers Week. But,
there you go. That would be great.
yeah, that is fantastic. And presumably if you're doing webinars and things, everything's going online, we'll be able to find out about that on your website, on the Care Workers Charity website.
Yes, we're planning the schedule right now, but there's going to be a lot going on. And if anybody's got any other ideas of what we may have to or we should include, please share them with us as well.
That's brilliant. Okay. Well, thank you so much, Karolina. Take care. Have some rest, because you're on the go all the time with everything you do. And we'll see you soon.
Thanks
Bye for now.
Bye.
So there you go. That was Karolina Gerlich from the Care Workers Charity, and also a massive advocate of care workers' rights and social care in general. So do keep in touch with what they're doing. Follow them on Twitter, and log on to their website, find out all the promotions that they're doing, and follow Karolina as well. She's some fantastic things, whether she's writing articles or talking about social care. It's really a great person to follow. So just again, another reminder. So next week we'll be having Kate Tironi, CQC. I really expect a lot of people to sign in, and please share, because remember that the regulator has a huge job in regulating the sector, in closing homes down that are not performing right. And also they do a lot of things around supporting care providers to do the job that they're doing. But I really would love to hear your questions directly for Kate. So do tune in. If you subscribe, if you like our page, if you're on YouTube, you have to click the bell to make sure you get notifications, so you don't have to think about it. You'll just know when we go live. You won't miss that interview. And of course, get in touch with your family, your friends, if you're involved in social care, your colleagues, and encourage them to come on to the live stream next week, next Wednesday, to talk with Kate Tironi. So thank you everyone for tuning in, and we really look forward to seeing you next week. Take care, everyone.